Chris here from the Whistle Stop Cafe in Mirror, Alberta. Sorry we're a little bit late. We had to roll an airplane into a hangar and get everything all packed up. The reason I wanted to do this live stream tonight is over the last little while I've told you guys and girls that we want to do our best to bring you credible information, and we want to seek out the truth. We want to seek out the people involved in the things that are going on right now, and we want to hear the information right from that person rather than relying on somebody else's podcast or somebody else's webpage. So what we did is we got in touch with Dr. Daniel Nagase, and as most of you know, Dr. Nagase, he got himself in some hot water for doing what he knew was right, which was treating his patients to the best of his ability and making sure that they got better. But AHS didn't like that. So now, just like me, although for different reasons, he's in hot water. But he did what he knows is right, and we wanted to make sure that you had the opportunity to see that, yes, he does exist, yes, this happened, and we're going to let him let you know why he did that and what it's all about. So,
well, I think people really have to look at the big picture, and we're talking about the really big picture. Never before in Western medical history have doctors been prevented and banned from prescribing a medication for something the medication wasn't initially created to treat. Whether it's minocycline to take care of strokes and reduce brain damage after strokes, or aspirin after a heart attack. That was a discovery because aspirin was originally a painkiller. But again, until this COVID-19 situation happened, doctors could prescribe any drug off-label. And it was an agreement between the patient and the doctor that this is something you could try and see if it worked. And as a patient, you're part of that decision-making process. In fact, as a patient, you're the most important part of that decision-making process. But now, thanks to Alberta Health Services and the College of Physicians and Surgeons of Alberta, you don't have that choice as a patient. You can't even have a discussion with your doctor where your doctor has the freedom to treat you as best he knows. So we just returned from a trip to rural Alberta. We won't say where. And it was to discuss with communities what they could do if they had problems that AHS was no longer serving their community. And as someone who's worked in rural Alberta since 2015, I hear the same story over and over again. I go to a community and they used to have a full-service hospital with a general surgeon. They used to deliver babies. They used to have plenty of beds. And after decades of Alberta Health Services management, these formerly full-service hospitals all over Alberta, they lose their surgical operating room time. Then they lose their obstetrics capabilities. And then they start losing beds. And even since 2015, since I started working in rural Alberta, I've seen beds close every year. I go to the same few places multiple times, year after year after year, in small places, and I see places go from 25 beds down to 20 beds, down to 15 beds. And in this pandemic, I've seen a few of the places I go to regularly cut down to 10 beds. And this is all under AHS. So we had a good discussion with communities about what they could do to try and stop the squeeze they're getting from AHS, how their hospitals that used to be full hospitals are being reduced and cut back. no longer able to serve the communities.
So I have a question for you.
Yeah.
In the newspaper and in the media, what you hear these days is we have this severe bed shortage because of unvaccinated people. Is this bed shortage new?
I think, seeing the escalation of beds cut in rural hospitals, that's the reason for the bed shortage. Beds are cut. And if you cut enough beds in rural areas, then the patients eventually have to get sent to urban areas. So the total number of beds, from my observations in rural Alberta, is the total number of beds is being cut every year.
Now, are they being cut because we had too many, or are we creating an inadequate situation in our hospitals?
You could argue that by cutting beds in summer, because fewer people get sick in summer, you're creating a bed shortage in winter. And some of these rural hospitals, they've been stable for decades. And then in the past 2 decades under AHS management, what's an acceptable number of beds in the summer is inadequate to deal with regular flu seasons.
I get it. So here's something that really bothers me about what's going on with you and how you're being treated. So as we've seen over the last couple of years, our premier, if any of the people in his organization, be it the MLAs, staffers, CA presidents, whatever, if they speak out, he drops the hammer on them and he makes them fall into line. It doesn't matter if what they're doing is right or wrong. Now what I'm seeing is doctors, and you're not the only one, there are others just like you, standing up and saying, this is wrong, we need to do something different, and this is what we can do. The same thing they're doing all over the world. But here, AHS is actually gagging doctors and nurses, telling them that they can't speak out about these problems publicly, and if they do, they're going to suspend them or take away their jobs. So to me, to know that AHS has removed the relationship that I have with my doctor, and they've taken that relationship and placed it within the organization, that really bothers me.
With people you've never met.
People I've never met, they don't know my
Your
situation.
choices as a patient are being removed by doctors you've never met who are in administration.
And the big question that I have, and probably a lot of people watching, why are they doing this? And we don't know what they're thinking, we don't know why, but I think it's a question that the general public needs to start asking their elected representatives, their doctors, anyone involved in healthcare, why is this happening? And they need to be asking their bosses. Because if we are in a situation where either people's egos or paychecks are getting in the way of proper patient care, we got a problem, and we need to deal with it. So, on that note, I'd like to say thank you, and probably on behalf of 99% of the people who are watching, for standing up and doing what you know is right. It means a lot to us. But there's men like you out there.
Thank you for being here and having a Facebook page where people tune in and getting the message out. Because I'm not a media person, I don't have a Twitter, and I open up my Facebook maybe once a month, so.
Well, we have a little bit of a Facebook following, so I'm sure there's going to be a lot of people that have seen what you said tonight.
All right.
Has there been any questions pop up for the doctor?
Most they can't hear, so turn it up. So just speak a little louder. How can we get ivermectin?
Ooh, it's a dangerous question that needs to be answered in probably a private chat.
I think people do need to network within their towns, because we saw a lot of that when we took this trip, that when towns get together, neighbors network with neighbors, people talk with each other, people can help each other, and they work things out.
Another thing that helps is loud voices. So if you or someone that you know is sick and you know that there's a treatment available that's accepted in other countries that isn't being allowed here, ask your doctor why. Write complaints to AHS. Use whatever channels you have within that organization to voice your complaint and your concern. Flood the complaint lines with, or AHS is not allowing my doctor to have a relationship with me. I just found out that if you are at risk of having an allergic reaction or an adverse reaction to any vaccine because of prior history, that's no longer a conversation between you and your own doctor. That conversation has been taken by AHS as well. And it's not right. We're in Canada, we have the right to proper health care, and a bureaucratic approach to somebody's health isn't right.
Wow. Someone you've never met should not have the right to make decisions about your health.
I agree.
Why weren't the patients who were treated by Dr. Nagase speak out?
Well, the two of them have recovered from COVID, but again, I haven't been able to see them. I know one patient, she is quietly taking interviews with media, but again, this is...
So on that